What does heart failure mean to you? Is that just like a heart attack?
When the heart stops working?
These are two common misconceptions people have about heart failure. In fact, heart failure is a clinical syndrome where the heart is unable to pump an adequate supply of blood to the body. It hence fails to fulfill the body's demands. It can also be considered a secondary condition, whereby there is insufficient circulation of blood arising as a result of coexisting functional or structural impairments in the myocardium, affecting ventricular filling and heart contraction. Disease etiology. The etiology of heart failure is multifactorial, with many primary pathologies that can be both genetic or acquired that cause some sort of damage, weakness, or stiffness to the heart's muscular walls. Common causes include coronary heart disease, cardiomyopathy, diabetes, hypertension, and valvular heart disease. Basically, any condition that hinders heart's physiological function can be considered a cause. Pathophysiology. This is a normal heart. During diastole, the heart is at a relaxed state. The deoxygenated blood from the body fills the right atrium and ventricle. In systole, the heart contracts, pumping the blood to the lungs for reoxygenation. Blood then returns to the left atrium and flows into the left ventricle. The heart contracts again, ejecting blood through the aorta to the rest of the body. In heart failure, there is an abnormality in this pathway, which can often be described by the four following classifications. Systolic heart failure occurs when the heart isn't pumping with enough force. There are many underlying conditions that could be responsible. For example, in CHD, myocardial infarction and ischemia induces hypotoxic cell injury. Meanwhile, in VHD and cardiomyopathy, the pumping efficiency is hindered, leading to the overworking of cells. All three of these conditions bring about the death of cardiac muscle cells. The myocardium walls, as a result, develop fibrotic scar tissue and become less elastic. When this is combined with the fact there are fewer functioning cells, the heart produces a lower force of muscle contraction and hence results in a lower ejection of blood. This is clinically characterized by an ejection fraction less than 45%, since less blood is ejected over blood filled. Diastolic heart failure occurs when ventricular filling is impaired. It often proceeds after systolic heart failure or when other conditions such as hypertension and diabetes also overload and stiffen the heart. The heart compensates by remodeling itself and enlarging its ventricular walls internally via concentric hypertrophy. However, this only leads to a smaller ventricular chamber. Hence, there is less blood being filled and less blood being ejected. Thus, the ejection fraction is preserved. There is also left-sided heart failure when the left ventricle insignificantly pumps the blood to the body, causing blood to back up and pool in the lungs. This fluid congestion in the lungs makes them less compliant, causing shortness of breath and irritable coughing. In right-sided heart failure, it's the right ventricle which insignificantly pumps blood to the lungs, causing blood to back up and pool in parts of the body. This leads to swelling or sometimes even edema in the ankles, liver, and the abdomen known as ascites. Ascites can also lead to reduced appetite since it compresses the stomach. Common clinical manifestations other than those that were previously explained include increased fluid retention and weight gain. Since there is less blood flow to the body, it provokes the kidneys to reabsorb more fluid, which also can promote edema. Also, lethargy and tiredness are common since less oxygen and nutrients to our tissues mean we produce less energy and feel fatigued. Lastly, tachycardia. As we need to maintain our cardiac output, the body compensates for the lower stroke volume by increasing our heart rate. Approximately 1.5 to 2% of all Australians are living with heart failure, with an incident rate of 30,000 to 60,000 new cases per year. Currently, heart failure is the second leading cause of hospitalization, as the risk of developing heart failure increases exponentially with age. Many surveys, including the National Health Survey, have concluded that females have a greater prevalence of heart failure when compared to males. However, males have a greater hospitalization rate. The indigenous population unfortunately suffer worse health outcomes, with them having 1.7 times greater prevalence ratio of heart failure and 2 to 3 times greater hospitalization rates.